Hello, I'm Joshua Sparrow at the Brazelton Touchpoint Center, and this is Learning to Listen, Conversations for Change. The Brazelton Touchpoint Center first launched Learning to Listen back in 2019 to remember, honor, and keep alive the legacy of our founder, Dr. T. Berry Brazelton, who died on March 13th, 5 years ago from this past Monday. To find out more about our founder, Dr. T. Berry Brazelton, the Brazelton Touchpoint Center, and Learning to Listen, just go to brazeltontouchpoints.org and click on Learn with Us and look for Learning to Listen in the Conversations section. There's also a link there to our archive of Learning to Listen conversations over the years. To learn more about and register for more Brazelton Touchpoint Center conversations, events, and trainings, click on learn.brazeltontouchpoints.org/catalog. You'll find that link in our chat here. To join the Brazelton Touchpoint Center's Learning Network, look for brazeltontouchpoints.org/programs-services/BTC Learning Network. Again, you'll find that link in the chat now. And if you are able and would like to help us continue to make programming like Learning to Listen free and available to everyone, please look for the donate link in the chat or the donate page at brazeltontouchpoints.org/donate. Any amount, whatever you can do that would feel good and right for you, would be a huge help. Thank you so much for being with us again today. And today, we will be learning and listening to Dr. Warren Eng, who is both an MD and holds a Master of Public Health. He's president of the American Academy of Child and Adolescent Psychiatry. and Director of Clinical Child and Adolescent Psychiatry Services and Medical Director of Outpatient Behavioral Health and Professor of Psychiatry at the Columbia University Irving Medical Center. In a moment, you'll have a chance to hear how he does all of this and his story, and to find out why we are so honored to have him with us today and to have him share what inspires him to do so much for so many. But first, a bit of information about today's Learning to Listen episode. Over 1,200 people have registered for today's webinar, and it's great to see you all in the chat. So keep telling us who you are and where you're from and what you do there in the chat. Today, our wonderful interpreter, Maria Jose Gutierrez, joining us again from Bogota, Colombia, will be simultaneously translating our webinar into Spanish. Thank you, Maria Jose. To access the translation, click on the interpretation icon in your Zoom controls, then select Spanish. To mute the English in the background, select Mute Original Audio. La conversación de hoy será en español e inglés. En los controles de esta reunión, haga clic en Interpretación. Haga clic en el idioma que le gustaría escuchar. Para escuchar solo el español, haga clic en Silenciar Audio Original. We are also providing closed captions today for those who would like to use them. To turn captioning on, please click on the closed caption icon in your Zoom controls and select Show Subtitle. You can adjust the size of the subtitles. Please do use the chat feature if you have a comment to share or need help with a technical issue. And please do put your questions in the question and answer box, and we will try to pause a few times along the way to respond to as many as we can. Now we know that many of you will be looking for your certificate of attendance. If you would like to receive a certificate of attendance for today's webinar, please do be sure you complete the feedback survey. That survey will open in your web browser at the end of today's webinar. And you will also receive a link to the same survey tomorrow in our thank you email to you that will also include a link to the webinar recording, as well as resources about today's conversation. The survey and webinar recording will be available in both English and Spanish. You can also access the recordings on our YouTube channel and on our website, again, if you go to brazeltontouchpoints.org and then Learn with Us and then Learning to Listen. Before we begin, I want to thank our sponsor, the Burke Foundation, which funds transformative prenatal to early childhood initiatives that unlock the full potential of children and their communities. And I also want to thank our wonderful Brazelton Touchpoint Center production team, Isabella Mantilla, Ashley Gaddis, Michael Accardi, and Suzanne Okasik. And now I'd like to introduce today's guest, Dr. Warren Ng. Warren Ng oversees the clinical programs in child, adolescent, and adult outpatient and community behavioral health at New York Presbyterian's Division of Community and Population Health. He also oversees the psychiatric services at the Morgan Stanley Children's Hospital of New York's Outpatient Emergency Department and Inpatient Services. Dr. Ng is president of the American Academy of Child and Adolescent Psychiatry, which we call ACAP, and also serves on the New York State Governor's Behavioral Health Services Advisory Council. At the American Psychiatric Association, he has served on the Council on Children, Adolescents, and Their Families. He has been an Aspen Institute Health Innovator Fellow and is a member of the Aspen Global Leadership Network and recipient of Columbia University Irving Medical Center's Martha Hooven Award for Excellence in Community Service. And believe it or not, I have shortened Dr. Ng's bio. Warren, thank you so much for joining us today. I am so eager to learn from you again.
Thank you so much, Dr. Sparrow. If I can tell you, Josh, that I think it's a real honor and a pleasure to be in this space with you and within community with all of you. And it's so wonderful to see folks really around the country come in and spend your time with us today. So I just wanted to extend my spirit of gratitude, and I'm just gonna set up my slides. So hopefully you can see that. I think that the honor and privilege of being in this space is also the wonderful invitation, as you mentioned, to listen and to learn. And as we embrace the process of learning, that never ends. And that is the beauty of it. So what I would like us to do is I'd like to invite you to listen not only with your ears, but also with your heart, and thinking about all of the things that we might hear as we continue to learn. So with your invitation, Josh, you were so kind to also invite me to share a bit about myself. I think that I have the privilege of being in this space and having the opportunities that I have and talking to you about harm and healing and thinking about mental health for AAPI and LGBTQ youth children. And I think that those in itself are such huge topics, and there's no way that I could ever do them justice. So what I would hope to do is really to point to some of the concerns, but also some of the opportunities that exist in that space. And what you've also invited me to do is really to share something about myself. So how do we come to the spaces that we occupy? And hopefully it's with presence and with acknowledgement of the other. So I don't have any financial disclosures, but I do openly disclose that I am continuing to humbly work on my own anti-racist journey, both inside and out, as I try to learn and unlearn the things that will hopefully help me be a better contributor to the world and the community we live in. I love quotes, so I'm going to really overutilize them in my talk today, and hopefully you'll enjoy them with me. And given that it's Women's History Month, but also acknowledging the power of really women in their contributions to all of our humanity. Just want to share Maya Angelou's quote. We all should know that diversity makes for a rich tapestry, and we must understand that all the threads of the tapestry are equal in value no matter their color. And it's really acknowledging that our diversity is our richness, and how we can gift that to not only ourselves but others. And I think one of the things, this is a bunch of family photos of mine. And I think another wonderful Maya Angelou quote is, you don't really know where you're going until you know where you've been. So I wanted to share that I come from a family of immigrants. I'm an immigrant myself. And as the wonderful hero and civil rights leader Harriet Tubman shared, that every great dream begins with a dreamer. And always remember that you have within you the strength, the patience, and the passion to reach for the stars to change the world. And so it's really with that starting, that with the limited command of English, my parents courageously immigrated with their 3 young children from Hong Kong to Canada in the promise of a better life. And neither one of my parents had completed high school. So my father was a cook and my mother was a seamstress, but that didn't define nor limit them. And so growing up in my family's coffee shop, I met all types of people, which enriched my worldview. And I have to say that the stories that I heard as I was refilling the coffee cups really have shaped how I see the world as well as how I see myself. Since neither of my parents had gone to college, they didn't really know what it would take, but they just assumed that if you work hard enough, as many immigrants try to, you can do it. So I'm grateful that they all saw that there were possibilities and dreamers do that. And so luckily I worked hard and I made it to medical school. When I went to medical school in Toronto in the late 80s, it was during the height of the HIV/AIDS epidemic, the other pandemic that has shaped my life course. And it was really another time when politics, society, and medicine collided. But what I saw within the hospitals, which really are sources of healing or places of healing, what I saw was painful, the impact of stigma, marginalization, and shame. And it really shook my sense of humanity and being a creature of my times and also a gay man. I saw medicine through the lens of HIV and AIDS pandemic. And I pursued family medicine to think about how to provide HIV care as a way to answer that call to help. However, once again, what captivated me most were the human stories behind all of those experiences. But what I could see amidst all of the suffering and the challenges was really the love and the courage amidst it all. So it was really during family medicine residency that, in listening to how people's lives were shaped by their experiences within, I really learned to love the stories that people were sharing with me. And my Asian culture teaches me to think about people in relationship to others. And that's why I love to work within families and thinking about everyone's role in contributing to each other's lives. And so, as a part of my experience, I encountered child and adolescent psychiatry and really psychiatry as a whole and fell in love with that as a way to complete that story for myself as well as for others. And one of the things that draws me to working with kids, as many of you work with children and empowering families to reach their potential, is the wonderful words of Frederick Douglass that it's easier to build strong children than to fix broken men. And so it was a no-brainer for me. And having the privilege of immigrating twice, I then immigrated to the US from Canada to really pursue my own dream. And of course, in New York City, the city of dreamers. And really thinking about when I came here, I worked specifically with children born with HIV and mothers with HIV and their children. And that really shaped how I understood, I think, some of the challenges related to health inequities, but also some of the challenges related to how we are not all treated equally, and hopefully how we can provide better care so that we can be more loving as well as caring in terms of the things that we can do. So this is Frederick Douglass's quote. And I wanted to just pause there before I sort of go into, I think, one of the main areas of my talk, in addition to my own experience. But I think sometimes when we bring ourselves to the space, we can hopefully learn about our own narratives, but also reflect on them, because with each one of those perspectives that I can share, either as an immigrant, as a gay man, or a child and adolescent psychiatrist, or as an Asian American, each one of them are only facets of who I am. And they don't limit me, but at the same time, what does limit me is the experiences of others. And that's where I really draw my inspiration from the stories of others so that I can best reflect on my humanity with theirs, but also remain open to learning about how we are different and yet how we can be enriched by each other's presence. So Josh, should I go forward? And
Oh, yes, please do. But I have one question for you.
oh yes.
Did you say which one of those little boys was you?
That's a good question. So I would say the one in the middle on the well, there's several of them. So I would just say that I'm in there somewhere, but I look quite similar to my twin brother. So
That's what I was wondering. Yeah.
um, so what I'll share is, in terms of the context of one of my identities and one aspect of who I am and what I can bring also to the experience of the other, is really thinking about the whole AAPI, the Asian American Pacific Islander experience. And when we think about this experience, it is such not a monolith, and it represents so much diversity within. And I really love the fact that there is more diversity within races than between them, which is often something that goes overlooked. But at the same time, within the AAPI umbrella, if we call it that large umbrella, there are over 50 nationalities, ethnicities, and even more languages. And even though they represent 6% of the US population, they have grown 72%, at least in the last census. So really appreciating this growing diverse community, and I would never even try to represent the whole experience, but hopefully, as I shared in terms of mine, how that perspective can contribute to this larger experience. And I love this quote by actually Bruce Lee. And I think as a young person growing up in North America, there are very few representations that I saw. One of them was Bruce Lee. And I think as an empowered Asian man, which was a sort of, this was definitely before the times of everywhere, everything, all at once. So I think given all of our collective experiences to date, someone had asked him, do you think of yourself as Chinese or North American? And he said, I think of myself as a human being, because under the sky, we are but one family. It just so happens we look different. And so I think coming from that perspective, I just sort of celebrate the idea that even though we are under that whole PI umbrella, we are all humans. And so with that, I think one of the things that I'd like to share from the AAPI experience is really the changes that have happened really since the pandemic in the last few years. Although, as we understand, racism and racism against AAPI folks have existed far beyond that time period, but I think it definitely raised awareness. So this is one of the organizations that really contributed to highlighting this collective experience across our country and how we can understand it. And I frame this in the context of understanding how we experience our mental health, as well as how we experience ourselves and our well-being. So with that, collectively, since March of 2020, the onset of the pandemic, really until the last year, there have been a total number of 11,000 reported hate incidents, and that, of course, is a gross underestimate of what often happens because we understand that most people do not report, and necessarily speaking, also what their relationship is with authorities and law enforcement can often be complicated by many issues in addition to language and culture. But one of the things that we often see is that 1 out of every 5 Asian Americans, if we take that as a collective, have experienced a hate incident in the past year. And this was really in the context of the pandemic experience, but also not only the verbal harassment, but also physically assaulted. But I think one of the things that I'm also very mindful of is that it isn't just our race and ethnicity, it's also our gender. So the role of misogyny and the fact that the vast majority of those who experience these incidents were women and AAPI women, which is really important to underline. So one of the things that came out, especially in 2021, when they were doing a nationwide survey, is really the idea of safety and the sense of well-being. So 50% of AAPI folks surveyed in the study showed that they felt safe going out, but the other 50 did not. But that the vast majority of folks were actually worried about family members and their elders. And that 32% of parents were concerned about their child being a victim of hate crimes or hate incidents. And among those who experienced these, they really experienced the US and our country as being less safe for them. And about 10% of youth aged 0 to 17 in the AAPI data showed that they were reporting incidents, which of course we understand could be underestimated as well. But also hate and those kind of experiences have a negative effect on our well-being and our mental health. So depression and anxiety, not surprisingly. And as I mentioned, I think one of the challenges is really the experience of how sort of racism and misogyny affect um, many communities of color, but particularly with the AAPI experience that was definitely shown by 74% of Asian American Pacific Islander women experiencing racism in the past year as a part of this ongoing research. One of the things that I think is a part of this important response is really the idea of visibility and also tackling some of those stereotypes, but also some of the challenges that we face with regards to systemic and structural racism when it's embedded within the fabric of our communities, but also ourselves. So these are some wonderful posters that were created by Amanda Pingbada Pikaya, who's a wonderful artist in residence as a part of the New York City Commission on Human Rights. And she created these wonderful, colorful posters that were shared throughout the pandemic at a time when visibility was so challenging, but also in terms of the mode and the mood of folks was so negative. So bringing color to the space, but also words that can be meaningful. And so acknowledging the fact that stand with us, we belong here, and really tackling some of the challenges related to the model minority myth and other things. So it says here on this poster, we are more than your Asian sidekick, the confused foreigner, the future doctor, your submissive plaything, the helpless refugee, the dragon lady, the straight A student, and numbers. But I think it's really appreciating how much many of the stereotypes, but also the model minority myth, which presupposes that there is one racial group that has abilities beyond the others, which is not correct. And yet at the same time, also creating divisions among communities of color um, against one another, because we know that these are not truths, but that they sort of establish, I think, misperceptions that can also affect folks who are Asian American Pacific Islander, because if the modern minority myth posits that you're hardworking, you're good at math, you're submissive, or that you do what you're told, and that you're sort of affluent and or successful, then that really underlies the fact that between the AAPI communities, there is the greatest racial and ethnic financial wealth gap within that group. So we have the lowest wealth within that AAPI racial ethnic category, but also the highest. And yet it's really the people who are at the lowest end of the spectrum who often then don't get acknowledged as needing the services and the support that they need. And when we think about some of those stereotypes, as well as the microaggressions, which was coined by Chester Pierce, as well as has been contemporized by Dr. Daryl Tsu, which is really helpful in terms of acknowledging that we have implicit bias, as well as, we are all equally susceptible to really having bias towards each other, but also within ourselves, and also how that could be manifest in terms of our interactions, but also our connections with others. And I think these are some of the microaggressions that Dr. Daryl Wing Su had really posited, particularly for the AAPI experience. And there are themes such as the perpetual foreigner, and the microaggression examples being like, where are you really from? Or you speak English so well, which is really the subtext of the communication that you're not really American or that you don't really belong. And then, as I mentioned, the model minority myth, which is really an ascription of intelligence, saying that one group is better than the other in different categories, which is not true. And that also kind of robs people of the acknowledgement that we have the largest wealth and income gap within the AAPI experience. And so people who are less privileged may not necessarily get the same attention for the services and the care that they need. And so these are just some of the other areas that can also be a part of it. But how does that contribute to the mental health experience? So whether or not it is AAPI hate or structural or systemic racism, or whether or not it has to do with the microaggressions, I think that that's all sort of situated in the context of the AAPI experience. So there are certain themes that are often a part of the AAPI experience, and there is in no way that this represents the whole experience of it within the umbrella. But I think from my perspective and how I can experience it just through my own lens, that I am informed by concepts such as Confucianism and the importance of humility, acknowledging hierarchy, and also social harmony as being an important part, as well as loss of faith, and really an idea of collectivism. So less of a focus on my individual identity, but really more of how do I show up representing my family, my collective sense of my identity, my relationships with others. And some of these different concepts also interact with how one experiences hate, or how one experiences mental health, or how one accesses or utilizes mental health services, which is also really important. The other thing that's often important is really understanding how we are all similar and different. And I think some of these cultural dimensions are not only unique of the AAPI experience, but it can also be very present in other cultural and racial and ethnic experiences. But one of the things that I definitely can appreciate is really the communication styles and being, I think, more implicit than explicit in terms of communication. So one of the things that I would say as we're talking about mental health and the AAPI experience is really just the fact that it's a cultural iceberg. So what we see on the surface is really such a small percentage of all the things that must go on underneath the water, which is unseen, which is often a part of, as I mentioned, some of the cultural dimensions of how AAPI folks might experience mental health challenges. When we think about the AAPI community, and this is from the MHA, in terms of some of these statistics, as I mentioned, if Asian American Pacific Islanders are 6.1% of the US population, and about 15% of folks who are experiencing a mental illness or a mental health condition, that's over 2.9 million people in this country. And that's more than all the dentists, teachers, and lawyers combined. And yet at the same time, we are all human and we are all experiencing many similar challenges, particularly during the pandemic. But as we're looking specifically at young people, and I'm going to focus a bit on my comments on children and adolescents, as we're thinking about some of the surveys during the pandemic that looked at young people and particularly students, one of the things that this one CDC study looked at was the fact that young people are experiencing racism in school settings and also with regards to their experience of themselves. And out of this one survey, out of the 36% of young people experiencing racism before or during the pandemic, 64% of them were identified as Asian students and 55% in this study as Black or multiple races. And I think one of the things that is often ubiquitous amongst our young people environment is really the role of social media and how much young people are experiencing racism through interpersonal contact as well as vicariously through social media, through other range. And this is really in the context of acknowledging that young people are increasingly experiencing poor mental health within their experiences during the pandemic that is only worsened because of it. It also underscores the fact that suicide is the second leading cause of death for all young people. And so therefore, especially as we're talking about AAPI youth, it's relevant as well. It is also the leading cause of death for AAPI folks aged 10 to 14 in 2020. And it's been the second leading cause of death, as I mentioned, for young people overall. But one of the things that we were also kind of mindful of is really how does that get experienced through the cultural lens? And as I mentioned, some of the acculturation as well as the cultural factors might affect how young people express their internal experience and their distress, and how well their families and their cultures of origin might be able to understand their experiences, which is also really important. So when we're thinking about AAPI youth and young adults, there's been an increase in terms of the number with serious mental illness. And this is SAMHSA data looking over time from 2016 to 2019, and that there's an increase over time of those suffering from major depressive episodes, as well as those who have serious mental illness. And when we look at past year and suicidal thoughts and behaviors, looking at the Youth Risk Behavior Survey, which is an incredibly important national survey looking at high school students, what we see is that among the different racial and ethnic groups, that Asian youth, in this particular example, in the 2019 data, shows that those that were experiencing seriously considered attempting suicide was about 29%, and about 16% had actually made a suicide plan. And that is compared to looking at other racial and ethnic groups as well. But of course, we have to acknowledge that the group with the highest consistent suicidal risk factors are American Indian and Alaskan Native and our Indigenous youth. So without a doubt, that population continues to be mostly grossly underserved. And it's wonderful that you had Josh, Dr. Melissa Smalls for this wonderful presentation to really acknowledge the role of our Indigenous youth and our Indigenous communities. So when we think about utilization of mental health services and thinking about, here I've shown you some of the data representing how some of our AAPI youth have been experiencing a very difficult time. But one of the things that we also share is that from the SAMHSA and mental health utilization surveys, it shows that AAPI youth and Asian youth in particular they utilize fewer mental health services compared to other racial and ethnic groups. And yet at the same time, they are similar in terms of prevalence for the mental health conditions. And as I mentioned earlier, may have been more affected by some of the issues related to AAPI hate throughout the pandemic. The one thing that is also important is when they were looking at the data at major depressive disorders, and if you can see in the red circle are those the Native Hawaiian as well as Asian as this category, that they are pretty similar to the other racial and ethnic groups. But when we look at actual treatment, we can see that they're much lower in terms of treatment utilization. And that really speaks to how cultures intersect with mental health experience, but also how there are different challenges and barriers, whether or not they're cultural or whether or not they're linguistic, or whether or not they're how you view the world in terms of how you access, but also understand mental health conditions as a way of receiving help or treatment. So I know that I can pause here for a minute and I will happily take any questions, but also any comments as we kind of launch into really our next section, which is really talking specifically about our LGBTQ youth and its intersectionality.
I was actually wondering if you might say more about your earlier comment on divisions among communities of color that separate one another. And then there was a question from Alvin Lee, which I will read to you. I wonder how the model minority myth has contributed to specific people of color groups targeting AIPI with hate. because of how existing racist systems reinforce the idea that if AAPIs can do it, why not others? This resentment may fuel the people of color on AAPI hate crimes and also reinforce racial stereotypes of other POCs and perpetuate the cycle of hate and fear we currently face on all sides.
Thank you so much, Alvin, for that wonderful comment. I think that, and thank you, Josh. I think highlighting specifically where the model minority myth has actually been, in some ways, somewhat intentional in terms of thinking about dividing and conquering. The model minority myth was actually developed after World War II, and it was really a concept that was coined to try to suggest that AAPIs, after the war, required fewer resources from the government in terms of support than other racial and ethnic groups in some ways. And because of that, they were more resourceful, they were more self-sufficient, and they needed less. And yet the communication about the other groups and communities of color was that they needed more and that they were less resourceful and resilient. And those kind of concepts are not accurate and not helpful, but they serve the purpose of really having the different diverse communities of color really look at each other with judgment as well as with misperceptions. The important thing is that that term, when it was coined, was really in some ways to also not acknowledge the fact that maybe AAPI folks at that time did not have the same access to support or resources, and that maybe because of other reasons, whether not language, culture, or other barriers, they were just harder for them to receive any support. And yet at the same time, instead of acknowledging that, saying that one is better than the other, or one is more resourceful than the other, or one is more capable than the other, if we're thinking about groups and people of color, then what that does is it creates a false dichotomy, and it also creates a false sense of ascription of intelligence or ability. And when we do that, we really disadvantage everyone. We disadvantage those that we supposedly call a model minority by not allowing them to receive really more of the services they need, particularly those that are at the full end of the spectrum. But also what it does is it sets up this dynamic with other communities of color to say that you're less than. And I think that those kinds of dynamics are very divisive, and yet they are also in some ways intended to keep the conflict between groups of color, as opposed to acknowledging that there is an inequitable distribution of resources across. And yet at the same time, it's important to note that there are many barriers as well as systemic and structural issues that affect how there is more equitable allocation of resources to all communities. So it definitely speaks to what you're talking about. And yet at the same time, I think that those are some of the things that affect many folks whenever we have these dynamics of power and privilege.
Fascinating, the history of the origin of these stereotypes and biases, and how if some people didn't have access to resources or had barriers that interfered with their being able to make their needs known, it was misinterpreted as not having needs. And then that being pumped up to turn people against each other. There are two more questions. One, I think you may be able to cover fairly quickly, and the other, I think, was probably a good segue into where you want to take us next. So let me give you one, which was just about the previous slides. Do we know why there wasn't any suicide treatment data for Indigenous/Native American participants in the last couple of charts?
Oh, very simply because I wasn't focusing on the important presentation around our Indigenous and Native Alaskan and American youth. If that was the case, I definitely would have shared it. But I think one of the things that I wanted to really try to highlight is that there are many different differences, but I think that the community that is disproportionately impacted are American Indian and Native Alaskan communities. I didn't share that data in terms of their treatment because I hadn't focused on that in this presentation, but I think that that is such an important area, and I'm not an expert in that. But that treatment and um, attention to the care of those young people is critically important for this country.
And that maybe takes us to this next question, which may be part of where you want to bring us next, which is how can we as a society help prevent suicide?
Thank you. Well, I think that we as a society, preventing suicide is definitely a whole presentation and a complex conversation in itself. But I would say that at its most universal level, the way that we can help people see that there are other options, possibilities, choices, but also people who care about them is really important. Um, Also acknowledging that when people have a mental health condition or a stressor in life, or that they feel that they are sort of habituated or addicted to substances or alcohol, that there is help, that there's treatment. And it's important to know that there is hope in that. So when that is a part of the picture, I think one of the things that we can all do is really to, as the beauty of this space is learning to listen. Um, and I think that that's often the most important thing is, are we listening with our hearts, and are we able to really hear what the other person is going through, making them feel known, making them feel valued, making them feel that they matter is really important. And then, as I mentioned, if there is a treatable condition, and there are many, particularly in the mental health and substance use arena, that they avail themselves of the help that they deserve. And hopefully it is centered on their needs, both culturally, linguistically, as well as respectful of their full experience. And whether or not that's gender expression or their identities, that's really important. So I think with that, I'm going to segue then um, with that wonderful question to really talking a bit about intersectionality. And I think as the title of my talk, Harm and Healing, it was really about different dimensions, whether or not it's the AAPI experience or whether or not it's our sexual minority status or LGBTQ experience. And I just wanted to take a note to acknowledge the wise words of Audre Lorde. There is no such thing as a single issue struggle because we do not live with single issue lives. And that's so important because we are so much more than any one of our descriptors, so much more than any one of our identities. And yet it's really our collective whole that gives it beauty as well as richness. But with each one of those different dimensions or facets of who we are, it can come with different strengths or challenges. And it's about being able to acknowledge that and how can we bring that to the discussion. When I'm thinking about LGBTQ youth and mental health, some of the important data throughout the pandemic, which was collected through the Trevor Project study, really showed that our sexual minority or gender minority youth are really struggling the most. And of course, the concern related to suicide is definitely there. So with 42% of the LGBTQ youth in the survey seriously considering attempting suicide. We know that the suicide ideation as well as the rate for LGBTQ youth can be 4 to 5 times higher than their heterosexual cisgender peers. And it's really important that we can appreciate the fact that this puts them at higher risk. However, when you put that intersection together, and as I mentioned, it's depending on the identities that that young person claims, that there's also racial discrimination, even within each one of those different facets of our identities. So even within the LGBTQ experience, that young people of sexual minoritized youth of color are often experiencing racial discrimination as well. And in this survey, 67% of Black identified and 60% of Asian Pacific Islander LGBT youth reported that. And it really just comes back to some of the data that I had shared before from a population perspective, looking at AAPI hate and how AAPI, even in this more national sample, really showed that the non-binary and gender non-conforming AAPI folks reported discrimination based on their identities, and that there are different levels of mistreatment as it relates to their identities. This is just another slide really showing the temporal trends and disparities in suicidal behaviors by sex and sexual identity among Asian American adolescents. The graph on the line, the orange line on the top shows those participants with partners of the same sex or both sexes. And the line on the bottom shows the participants whose partners of the opposite sex, or what we may think of as being heterosexual, and the orange being sexual minority youth. And so thinking about the suicide plan, we can see that there's an elevated percentage of those young people that has only increased from 2015 to 2019 over the past really 5 years of that period of time, which is a concern. The other thing that we do know is that suicidal ideations and behaviors in Asian American youth can also differ based on the acculturation, and that's how well their parents and their family members understand their experiences of being an Asian American youth in this country. And so what they call the levels of acculturation and impacting suicidal risk is that if you have a parent who is less acculturated to the North American or the American experience, and you are a sexual and minoritized youth, that you may have more challenges with regards to expressing yourself, feeling safe, but also feeling accepted within that family system, because it's harder for you as that young person to try to bridge that gap of that cultural understanding of what it's like for you to be in this country and identifying as a LGBTQ youth in that experience. So the less acculturated Asian youth were at proportionally greater risk for suicidality under the conditions when there is higher parent-child conflict, which really speaks to how well we can best support young people, but also particularly with their families, and how we can best work with parents. Caitlin Ryan, who's done some wonderful work with family acceptance, really demonstrates the impact when we are able to, when it's in the young person's best interest, to work with their families and their parents to help them gain a greater sense of their self-acceptance, but also within their families of origin. What we do see, and this is the most recent youth risk behavior survey, is that those high school students or adolescents who are most at risk for considering suicide across all race and ethnicities is actually sexual identity, or as they report, having partners of the same or opposite sex or any sex. And I think that that's one of the things that we need to just be mindful of, is that our sexual minoritized youth are actually having the most difficult time amongst all groups as we're thinking about these different categories compared to even any of the racial and ethnic groups. So we're understanding that when there is that intersectionality, both with race and ethnicity, as well as sexuality and gender identity, that those things can be increasingly more complex and more difficult. And as I'm talking a bit about AAPI, sexual minoritized youth, that those two different aspects of their identity can make it actually more difficult for them to negotiate their own sense of their self, as well as their sense of self-acceptance and also acceptance within their families, communities, and peer groups. So there are different strategies and there are specific barriers that are identified as being issues related to AAPI mental health. And as I mentioned, the utilization for AAPI folks is much lower than other groups, but that's an important area to acknowledge. But also the fact that there is benefit to having more culturally aligned, linguistically appropriate, but also youth-centered care that can make an impact. On the flip side, some of the positive things in terms of what we've seen, even looking at our adolescents across that whole LGBTQ spectrum, as well as the racial and ethnic identity, is the fact that connectedness is protective for youth, children and adolescents. And the more that we're able to have young people feel connected, feel that they're seen, that they're heard, that they belong, that those things are powerful protectors against some of the mental health sequelae, but also in terms of any suicidal risk. The other parameter that is also important is parental monitoring, and it seems a little bit more kind of ominous than what it is, but it's really about parents knowing where their kids are and who they're with and having an interest in them. And I know that in these surveys, they were fairly simple, but I think that the more that we know that there is a positive connection, particularly when there is more positive relationships between young people and their families and their parents, that can be very protective for the young person when it's relevant. So with that, I know that we're nearing the end. I wanted to also just acknowledge that this wonderful quote by Mother Teresa, if we have no peace, it is because we have forgotten that we belong to each other. And that's really just an acknowledgement of how important it is that we all belong, and that part of what we can think of as being supportive and protective is really how we can best see each other, listen to each other, and also be able to acknowledge that we're all important as we can contribute to this larger collective experience.
Thank you so much, Warren. There were lots of really important and fascinating questions and lots of appreciation. I want to bring one to you because the word acculturation can be a real flashpoint for lots of people who've experienced attempted cultural genocide. And in that context, acculturation is understood as meaning efforts to wipe out one's ancestral and heritage culture. And here, the question we have is, if you could speak about the protective factors of enculturation that could offset the negative impacts of acculturation and suicidality. And I think what that's getting at is the research, and this goes back to the research that I'm aware of in Indigenous communities, where continuity of cultural identity has been a strong protective factor against suicide risk. So perhaps you could speak to that, because acculturation means different things in different contexts, but often can be this very painful notion of having one's culture diluted or attempted erasure of it.
Thank you, Josh. That is so important. And thank you so much for bringing up that flashpoint, because clearly the value the protective factors of enculturation, acknowledging the richness of our own identities and diversities, but also culture as treatment, culture as caring, culture as healing. And that has definitely been a really key part of what I take away from the experiences within Indigenous communities and how that has been so powerful. But it's also acknowledging that there's a history and there's a past that has not been respectful and or understanding, um, and that there is a level of cultural genocide that has impacted generational trauma, as well as really how one views oneself. And so I totally take that point. And that's such an important one to emphasize as we're thinking about these different ideas of ethnic pride, racial pride, acknowledging our past as well as how it informs our future and present is so important. So thank you. I think that that is incredibly important, and how we can best celebrate not only what makes us unique and diverse, but also how that connects us in our collective humanity with each other. And what do we share? And we share so much more than we are different.
Thank you so much, Warren, for bringing your story to all of us, as well as all you've learned in the work that you've done and continue to do in these very difficult and challenging circumstances. There were lots of questions about how to help. And so we're going to have you back so you can tell us more about that. Thank you, Warren, for being with us. And thank you all for joining us today. I hope that we will see you again. I hope you'll come back on Wednesday, April 12th, for our next Learning to Listen episode on human-centered design for a world without racism. We also hope that you'll come back for our other events and offerings, and we are very excited about our national forum coming up the first week of May, May 2nd through 4th. It is virtual. Hopefully you'll all be able to make it there. And it's all about fathers and the men in children's lives. And we are talking about cis and transgender fathers and men. So thank you for coming today. Stay well, and we will see you again soon.